Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists veterinary associates with employment contract and independent contractor agreement issues. Today I'm going to talk about bonus structures for veterinary associates. So how they could be paid, either a productivity bonus or a discretionary bonus, or some of the bonuses that exist, and then also some red flags to think about if you are compensated via a bonus structure. So let's talk about kind of standard compensation structures for a veterinary associate. So first, you would have just a straight base salary. This is probably the most common way to compensate somebody. No bonuses, no ProSal, and I'll talk about that in a second. You just get a straight base salary and that's it. And I think, as somebody who reviews hundreds of veterinary associate contracts, that's clearly, the most common way to compensate a veterinary associate. Now, if you're doing relief work, if you're doing urgent care, emergency medicine, in those situations, a daily rate or an hourly rate is more common. So let's talk about kind of productivity bonus structures. So kind of the easiest way would be you have a straight base salary, and then you'll receive a percentage, either monthly or quarterly or annually, of any collections that the practice receives. And so how that would normally be structured, let's just use 20% as the guide. So let's say you make $120,000 a year. What they would do is they would take, they're paying out $10,000 per month. And so at the end of the month, they would do a calculation. And if you were getting 20% of the collections, they would take 20% of whatever was received based upon your services, subtract out the $10,000 that they paid you via base salary, and then that's what you would receive as a bonus. Now, just doing quick math here, let's say you brought in $50,000 in a month, so 20% of that is $10,000. They paid out $10,000, so you wouldn't get any bonus for the month. So in that scenario, you would need to make over $50,000 per month to receive any kind of productivity bonus. That's a fairly standard way of doing it. Now, the variables, as I said before, are when it's reconciled and when it's paid. So it could be monthly, quarterly, yearly. Now, the biggest thing to think about here is the language that speaks about when you will be paid, and then whether you have to be employed when it is paid. So from a veterinary associate perspective, it's much better to have a shorter interval because you will get paid more. Think of it this way: if you're paid monthly, you're going to get that money every month, whereas if you're paid annually, you got to wait all the way until the end of the year. And then many times the contract will say you have to be employed at the time the bonus is paid. So perhaps, you leave in November, you worked most of the year, maybe you did attain a bonus, it's never paid out to you. You also want the timing of when the bonus is paid to be in the contract as well. I've found some employers will drag their feet on paying out the bonus at the end of the year if somebody has given notice and wants to leave, or perhaps they just want to hold on to that money as soon as possible. A reasonable amount of time is around 30 days from the end of whatever the reconciliation period is to be paid out to the veterinary associate. So those are two things you need to think about. One, when it's paid, and then two, do you have to be employed at the time it is paid? Discretionary bonuses, it can be written into a contract, but you can't rely on any of that. In that case, it would say the practice may pay out a bonus if they feel like it. So anytime you see language that says there's a discretionary bonus, you simply can't count on it. Sometimes you'll see a retention bonus, and that would mean if you stay for, it's almost always the entire year, then they'd be paid out somewhere between $5,000 to $15,000 would be a reasonable amount. And that would be just go straight to you. You don't have to pay it back if you leave. It's just if you stay for the year, that's the amount that you will get. Now, there are other methods of compensation that I wouldn't really consider bonuses, It's just how you're paid, and that would be if you're paid purely on collections. So let's just say, the ProSal model is utilized in the veterinary industry, and I guess there's different types of ways people define it, but for the most part, it would be you would get a draw, and so you would kind of get a set amount of money every pay period, and then at the end of the month, they're going to reconcile how much they paid to you via what the percentage is. Usually in ProSal, it's somewhere between 18 to 22%, and then if there is extra money left over after they calculate what they paid out versus the percentage and what we went over at the beginning of the video, then they will pay to you. The difference is when you're paid purely on this, they will carry forward negative balance. So if you didn't bring in enough to cover your base, that negative balance will carry forward with you, and then at some point you'll have to pay that back. So that's another way of being bonused, although I don't consider that a bonus. That's just how you are compensated. So those are a few things to think about as far as bonus structures or veterinary associate. If you have any questions about your contract, please contact my office. All of our contact information is listed below in the description, and I appreciate you watching the video. Thanks.